Oh my God, the experience of treatment was a roller coaster. I think I changed medications like 3 times.
I probably went through 3 different pills.
There are times when I used to take over 6 tablets.
And sometimes I had family visiting from Fiji as well, so I didn't really want to disclose to them why am I taking a pill every morning because they were staying with me.
In the early 1990s, there was very little in the way of treatment.
Was things like AZT, and often it was given at higher doses, and those doses were quite toxic.
The first medication that I was taking, which I can remember the name, they gave me like really bad stomach pain, sending me to the toilet every 5 minutes.
You'd take it, half an hour later, you'd have a bit of a fuzzy head for a bit, and then you'd be fine. One of them I was like, I swear I was gaining weight. The other one, I swear I was getting up in the middle of the night and eating food.
As a little child, maybe around the age of 8, 7, when I had to take syrups. So we used to go to the health facility and pick 4 bags of treatment that were only syrups. Oh my God, that was everyday food.
They really didn't give HIV treatment to people until they were very unwell, because often the HIV treatments were going to make people sicker than the HIV.
I was very lucky that HIV treatments did have some effect for me. I knew lots of people who really couldn't tolerate treatments or didn't believe in them or didn't want to take them, and they, unfortunately, I think all of those people have passed away.
So I got immediately handballed from this little clinic to the ID clinic at the Alfred. And it was at the time when research was like, oh, do we start treatment straight away? And I was part of a study called the START study, where you get sort of randomized into you're either gonna not start treatment or you're gonna start treatment.
I started treatment pretty much straight away after my diagnosis because I already had a low T cell count, and that means my immune system had already been damaged by HIV.
And so I spoke to them and ended up getting on treatment basically straight away, which is positive in a way because that's what the study ended up finding out, is that it's better to start early.
The amazing news is that today the tablet, I take a single tiny little tablet.
And then it was just a pill a day.
Currently, I'm only taking 1 tablet, so the treatment is changing over time. There's so much research that is being done, which is quite interesting.
It's very, very effective. It completely suppresses my HIV.
When we found out about U equals U, when it sort of really was a thing in Australia, which was 2018, it was a revelation.
For those of us working in the sector, we knew that it was coming.
The U equals U campaign was massive for me.
It gave me a lot of peace of mind.
Doctors already knew about that. When I would go to my HIV doctor, they would sort of say, oh, you're not going to, you can't pass HIV on.
Because the science was becoming clearer and clearer. But once it started to become popularly known within the queer community and with the broader community that people who are undetectable and HIV positive can't transmit the virus, it's been transformative. It's really, really one of the most profound things that's happened to HIV stigma in the time that I've lived with this virus. It's really changed our sexual cultures in a really positive way.
Before the U equals U campaign, that's when I was really scared to have sex. I was really scared to pass it on to my partner. I was really scared to go out and have any casual relationships. I abstained for sex for a number of years.
U equals U it's a powerful tool, for people living with HIV. It gives us that confidence that I guess sometimes we need to reassure ourselves.
And also giving us a really strong argument to get people on treatments because HIV treatments not only save your life, but they reduce or eliminate the risk of transmitting HIV to someone else.
If I chose to have a relationship with a negative partner and tell them about U equals U and say that if you have unprotected sex with me, you are not going to get HIV.
Being undetectable means for me is I'm safe, and I'm also keeping other people safe by taking and doing the right thing. So that's really amazing, but it's hard to explain to people what U equals U means because most people don't really know about it still.
Are they going to believe the science? And that is the issue. I think a lot of people out there in the general community, 1, haven't heard about U equals U, and 2, even if they had heard about U equals U, they don't believe it, because HIV is such a concept filled with so much fear.
It took a while for me to break down the barriers that were up, because they don't just go away from somebody tells you that, you know, you can now have unprotected sex, it's going to be fine, you're not going to pass it on. It doesn't change it. There's a lot going on inside, up here, in here, that needed to be broken down before I could do that again.
And then also there is research that is being done on, you know, injections.
So then I learned about the injectables, and like I got my first one.
So now I get injections every 2 months, and it's the best. Now I don't have to take a pill every day.
That was amazing. It was sore, but like it was good because I don't have to worry about taking a pill or people knowing about that.
It's also the freedom of, you know, going out to see my friends and don't worry about, you know, waking up the next day somewhere without the pill in my hand and, you know, having to worry about missing a day.
You know, one in each cheek. I mean, it kind of makes me think I'm, you know, got gonorrhea, but anyway.
There's going to be a time when we're only getting one injection a year.
It's beautiful to know that there's such medical advancements that allow me to do that.
It's been a long, long journey to get to that level of incredible scientific advance with treatments, and a lot of fighting done by queer people, gay men, lesbians, and other people who support our communities to get access to those treatments, not just here but around the world.